This topic is anger and aggression. Let's first talk about anger. This is a healthy, normal emotion that occurs in response to frustration or being hurt or fear or anxiety or grief. It is a warning signal to an impending threat, and it causes sympathetic nervous system activation. You can see how the body responds to that fight or flight activation in the image here. The activation of the sympathetic nervous system is readying your body for a threat. And anger can vary in severity, from irritation all the way to rage. Signs of anger. Think of what you do when you're angry. You might have clenched fists, or a flushed face, or tense, anxious, or even an angry facial expression. You might have a defensive posture and become passive-aggressive in your behavior. You might be hypersensitive and easily offended. Your emotions may become uncontrolled, and you may be yelling or shouting, or even low-pitched verbalizations forced through clenched teeth. Consequences of unresolved anger. Anger is a very powerful emotion. If you have repressed anger that's denied or buried, it will affect you physically with migraine headaches, stomach problems with ulcers, colitis, even heart disease. Anger turned inward causes depression and low self-esteem. And then suppressed anger can lead to resentment and passive-aggressive behavior. All of these can affect our relationships with others. Now let's talk about aggression. That is the physical or verbal response to anger, and it's intended to cause harm. This comes from wanting control or display dominance or power over another person. This can be due to conditions in areas of the brain that regulate emotions or impulse control, like a brain tumor or traumatic brain injury. It can also be caused by neurotransmitter imbalances of dopamine or serotonin. Signs of aggression include hyperactivity, maybe pacing or restlessness, a panic-level anxiety, suspiciousness, anger that is not appropriate to the situation. Maybe it's an incredible amount of anger for a situation that others would think wasn't that big of a deal. Damage to property, yelling, or use of offensive language, and then verbal threats to cause harm to self or to others. And they may cause physical harm to themselves or others. Nursing interventions. We want to assess a client's risk factors for aggression. Do they have a past history of violence? Do they have a diagnosis that could cause them to lead to violence? Impending signs of violence. We can complete a violence checklist. There is normally an escalation towards an outburst of violence. Doing a quick checklist can help determine if the client is likely to become violent. It looks at behaviors, irritability, physical and verbal threats, and violence towards objects. We, of course, always want to document all of our observations. And we want to monitor for those escalating behaviors, the prodromal syndrome. These are similar to what the violence checklist looks for. Tension and anxiety, loud, rapid speech, verbal threats with offensive language, increased hyperactivity, threatening body language, maybe a rigid posture or clenched fists. Nursing interventions for anger. We want to determine the source of anger. What is causing them to become angry? We can encourage the client to write in a journal their angry thoughts, what triggers their anger, and then resolution of past situations. We encourage ways for them to reduce stress, like meditation or exercise. And we can role model healthy ways of expressing anger. We want to be an example of how they should act and respond. Nursing interventions for aggression. We first want to make sure there are enough staff members available to assist, to keep everyone safe. We want to diffuse the anger with least restrictive means, because restraining them might cause them to become more angry and eventually aggressive. We want to keep a safe physical distance and close to the exit door. Never allow yourself to be trapped in a room. So we need to make sure we have clear access to the exit. We want to make sure we don't get caught with a client between us and the door. We also want to use de-escalation techniques, and we'll talk about these more in a moment. And we may have to offer PRN medications if necessary, if our other techniques are ineffective. De-escalation techniques. This is the use of communication, body language, or actions to reduce the potential risk for violence. We first want to talk in a calm voice and express concern. I find if you talk in a calm voice that's a little bit slower and you allow them to have to listen to you and you express concern for them, they will also start to calm down. You can offer food or drink or even a phone call. Is there someone they trust that they can call? We want to take on a non-threatening posture. We don't want to be like this or domineering. We want to take on a non-threatening posture with open hands. We can offer redirection and limit setting, limits on their behavior and consequences to their behavior. And then distraction activities like music or exercise, walking, or doing something constructive with their hands. Has something worked in the past for the client? Or we may need to move them into a quiet room. We may need to decrease stimulation and loud noises. Your number one goal should be to keep yourself safe and your clients safe too.